Assistant General Manager in InnoCare Life Sciences Private Limited. On behalf of the InnoCare Life Sciences, I welcome you all. It's our great honor and privilege to welcome you for the first Indian Medical Cannabis Advisory Board of 2025. Your presence today marks a significant steps in shaping the future of pain management and the patient care in India. It's our honor to have a great personality amongst the orthopedic fraternity, Dr. Ram Prabhu sir, as a chairperson of the event. Welcome, sir. Dr. Rajesh Gandhi, sir, as a chief guest of the event. Welcome, sir. Dr. Mitesh Walvi is not here. He is about to come. He will reach another 5-10 minutes. He is working as a moderator of the event. Dr. Vijay Dev, who is the InnoCare's medical advisor and the coordinator of this event. Welcome, sir. So before starting this event, I would like to invite all Dr. Ram Prabhu sir, Rajesh Gandhi sir, to inaugurate by lighting the lamp, sir. Even Aditya Khemka sir, you can also join, sir.
Come, sir.
Come.
Aditya, आजा. Come. हो जाएगा जरा. चल आजा.
Now I request Mr. Dipin Verma, who is the director of the company, to come here and show the overview of the InnoCare Life Sciences company. Thank you, sir. Welcome.
Thank you, Harish. So I also, on behalf of InnoCare, welcome you all to the first medical cannabis ad board meeting. And really, we are overwhelmed to see that such an August gathering here, which really encourages us to conduct such kind of programs, even more often and more frequently. So I will just take your 2-3 minutes to just give you an overview of InnoCare Life Sciences. InnoCare Life Science is relatively a very younger company. We launched the company in the year 2014. And in a short time, with your blessings, we have become the pioneer in the first time in India brands. We are bringing in the world-class technologies, and today it is trusted by more than 25,000 healthcare professionals. And also there are millions of happy consumers. We have also have a good number of accreditations across in India as well as in abroad, where we get our products manufactured in WHO GMP standards factories. We are in fact FSSAI certified, and we get all the central licenses in place and compliances, and also we work along with the ISO 9000 companies. So sir, today Mr. Lalit Vadavan is a managing director. He was not able to attend the meeting. He was very keen, but he was just been convalescing from a recent surgery. So he's a managing director of the company. It's always blessings with us, and he has sent his good wishes to all of you. Myself, Dipin Verma, as you can see, and also my colleague, Mr. Vijay Dubey. He is the director sales of the company. So we together has been the promoters of the company, and with your blessings, we have now taking forward to become the #1 Nutra company in bone and joint, women's health, and lifestyle disorders. Sir, we have marked a presence in all over the country. As you can see that in all the practically in all states except for 1 or 2 states in north, We are there in all parts of the country. We are available. We operate through 19 consignee agents and more than 600 stockists. Our major presence is in Maharashtra, West Bengal, Tamil Nadu, Orissa, Karnataka, Bihar, and practically all the states, including UP. We, as I said, that we get our products manufactured in high-tech facilities, who follow WHO CGMP standards. We have a very good presence in the orthopedic segment, gynecology, internal medicine, general wellness, supportive diabetology, and also in sexual health segment. Sir, our branch, with your support, has now become one of the topmost in their respective segments. Like example, Tendo Shot Pro, InstaActive range, InstaActive OA, Cola Shot and Cola Shot 4 with Cola Shot C2 and Cola Shot C2 Plus. Also Liga Shot, Richcal, and also Instaflex range, which is our drug range. We also have a very good physician range in the form of T3 as our flagship brand, which is the #1 brand of the company. So T3, T3LC, T3D3, and including T3 Plus. We have also having a very good presence in the sexology segment, sexual wellness segment, with the brands like eDrive and eDrive C in both male as well as female sexual disorders. We also have one division which focusing on gynec portfolio. So where in infertility as well as in gynec and pregnancy range, we have Inofol, Efem, Metinofol, and Fertilix OVA kind of products, which helps the patient deal with pregnancy and infertility cases. So we are very proud to say that we are one of the very few companies who conducts clinical trials for nutraceutical brands. We have conducted 4 trials till now for Tendo Shot Pro, Cola Shot C2 Plus, Liga Shot, and also now recently we have conducted a trial for Fertilix OVA also. And these are all done at CTRI approved facilities. So sir, we have also been amongst the proud recipient of the AWACS Award of Excellence, Brand Excellence for Cola Shot C2 we have received. So this has been, of course, all blessing through you, that we have come out with all new product launches like InstaActive Forte, InstaActive Gel, Richcal Bio, and even Beneflex for hemorrhoids as well as for varicose veins. In fact, recently we have also come out with a very innovative formulation of Cola Shot Glow, which helps in hair, skin, and nails. And of course, now introducing the first time in India medical cannabis in modern medicine. So for which I think we all have gathered here to deliberate and discuss more in details about what will be the use of medical cannabis, and in the different formats, like it will be oil, patches, and also in the emulgel form. So sir, we basically believe in building brands. Our brands like T3 have now touching 25 crores. Cola Shot Group is 15 crores. Tendo Shot is 15 crores. Inofol Group is touching 10 crore. Liga Shot Group is touching 10 crores. And InstaActive Group with very soon with a new edition will cross 15 to 20 crores. eDrive Group in the sexual wellness is now 5 plus. Efem is also touching around 5 plus. And Instaflex range, which is aciclopanac and thiacolchicoside range, is also doing very well. So with your blessings, sir, we always feel that InnovCare's pride is our pride, and we, through InnovCare, we would like to bring in the innovative healthcare solutions so that which can help your patients in turn and help them lead a good quality of life. Thank you very much, sir. Thanks a lot. So I welcome now Dr. Bijoy Dev, who is the coordinator for this ad board, and I request sir to take over the session and take it forward. Sir. Over to you, sir.
Good evening. Thank you everybody for presenting over here. This is advisory board meeting in the orthopedic segment. I welcome for all of you, this esteemed orthopedic advisory board members. Thank you for your time, expertise, and also your willingness to collaborate with us. Particularly in this particular ad board meeting, we would like to explore the use of cannabis, the legal problems. Certain problems are there because in certain countries it has been approved for medicinal purpose, in certain countries for recreational purpose. In certain countries you will find that recreational as well as medical purpose. So we'll go at length, we'll discuss regarding this aspect. And now it is being used also in different types of diseases like your Parkinson disease, even also epilepsy. And in case of chronic pain, it is being used abruptly in different places. Now this advisory board, actually why we have made this advisory board, because it is a structure, complaint forum for clinical discussion. Particular purpose of this advisory board to gather insights, to align strategies with real world needs. Now this insight, whatever inputs we'll get from you, that will be published in the index journal. How we will publish these things in the index journal? Either in the letter to the editor, that is editorial note, it will be published in the first page of the journal. And this journal will be Indian Journal of Orthopedics or International Journal of Orthopedics. It can be also published as a medical bulletin in the category of medical news. And the third one is the review article. As a review article, it can be also published. So this ad board, basically we have made because chronic pain has remains a major quality of life issues. And you will find that whatever the conventional medications we have, that is your non-steroidal anti-inflammatory drugs, opioids, there is a lot of limitations. Even also there is a problem of your efficacy, side effects, and tolerability. So we would like to explore this cannabis and cannabinoids as alternative and adjunctive therapy. Today we have gathered for the same, how we can reciprocate that yes, this particular cannabis and cannabinoids will be the future prospects. So we need your clinical, ethical, and regulatory potentials. So objective of this meeting in a nutshell, we can say that we would like to exploring the existing and emerging clinical data of medical cannabis, and we would like to see the knowledge gap. Basically, if you see that the concerns, a lot of people, they know that cannabis, basically, it is meant for recreational purpose, but does it have the medicinal use? Yes, we have to explore that the medicinal use which is being taken into consideration in different countries, also in India, and it has been approved particularly for medicinal purpose, not as a recreational purpose. So we would like to future pathway for education, trials, and integrations we would like to get from your end. And we would like to see that your expertise that regarding the safety, efficacy, and your usability of cannabis. So in a nutshell, this chronic pain remains a burden. So innovation is the key. So we would like to say that expertise help us move responsibly and thoughtfully. We value your time and insight, and we would like to see that in future we can take forward these cannabis further. Let's lead the future of pain care together. Thank you. Now, our first of topics which we have taken into consideration, that is cannabis medicinal significance. I will request Dr. Chittaranjan Das to come over there, or you can, from your place itself, you can give the presentation of, if you like to give the presentation from the dais, you can do that.
Good evening, everybody. I am glad to be here. I am thankful to the No-Care team. Today we are discussing about the cannabis. My topic is in-depth analysis of a controversial plant. Is it a controversial plant, the cannabis? Now at this point of time, we are talking this as a controversial, and everybody is taking it as a normal way. This is a controversial plant. If you will see, it was considered to be a holy plant. It was considered as a sacred plant, used medicinally and integrated with yogic and spiritual discipline. And it was, the original name is Bhang in Sanskrit. So, in modern re-evaluation, when we are doing researching about the cannabis now, we should consider the historical as well as Ayurvedic and spiritual legacy of this particular plant. This Vedic literature mentions that Bhang, that is the cannabis, nowadays it is called as cannabis, is one of the 5 holy plants with medicinal and spiritual powers. It is written in the Atharvaveda. It is 1500 BC. It is so old, and we, in this part of the globe, we knew about the medicinal value of this particular plant. And it was regarded as a source of happiness, liberator, and giver the joy to the devotees of Shiva. In Sushruta Samhita and Charak Samhita, these are the Ayurvedic texts, it is already written the medicinal values and medicinal use of this particular plant. And in Ayurveda, we use it for the pain, digestion, and sleep disorders, anxiety, epilepsy, anesthesia purpose, as well as aphrodisiac purpose. So it is not a new thing, because it become a taboo to use this, and it is a there are some rules, regulation change. That's why this holy plant became a issue in our country. The rishis were believed to use this cannabis for the meditation, for various rituals. It is for the quieten their ego. It is used for the aids of the dhyan. In Vedic time, it was called as in Sanskrit it was called as Bhang, but in Roman era, this is around 200 years back, 1753, this name was coined cannabis. This is the Latin language. It is called as cannabis. Now we are talking everything as cannabis. Why it is a controversial? Because of British colonial rules stigmatized this particular thing, this particular plant. So this is a controversial right now. Despite of widespread use of this medicinal plant in Unani and Ayurvedic medicine, cannabis become regulated under colonial narcotics law. And in 1985, there is a NDPS Act. They banned cannabis resin and flowers and allowed the bhang, that is leaf of this plant, due to its deep cultural root. Only because there is a deep cultural root, that's why it is now existing, or else it is, and it is in regulated way. The culture of this plant, cultivation of the plant is regulated, and the use of these leaves are also regulated. The colonial era, this particular plant is widely accepted and medical as well as spiritual use. In 1894, it is recommended for regulation and not prohibition. In 25, a mild pressure for the restriction. Then in British Raj, taxation and license were required. After that, in 1985, one act came, and banning of the flower, banning of the resin is occurred. Then the only bhang was allowed at that time. Under NDPS is charas and ganja. Charas is the resin part of this particular plant, and ganja is the flowering top. They were banned. Only allowed was only the leaf, but with a central and state government regulation. Now, before going into the medicinal part, we should understand the cannabinoids. What is cannabinoid? cannabinoid is a term, which the term is coined in 1960. This is very recent, 16. And cannabinoid literally means a compound that is derived from cannabis. The class of chemical compounds that interact with cannabinoid receptors in endocannabinoid system, like sympathetic system and parasympathetic system, we have a cannabinoid system in our body, and that was hacked by the rishis in that particular old time, and that is why the Indian people, this part of globe, these people were healthy without any medicine. Only this type of tulsi, this type of bhang, all these things. With this, they used to be very healthy. The endocannabinoid system, their receptors are two types. One is CB1 and CB2. Mostly CB1 is centrally placed, and CB2 are the peripherally placed. CB1 is mostly in the brain, cardiovascular system, lungs, muscles, gastrointestinal tract, reproductive systems, and immune system, liver, bone marrow, etc. And CB2 is mostly into immune systems, bones, spleen, skin, etc. These are the CB1, CB2 receptors in the cells. When the cannabinoids are of three types. One is endocannabinoids, phytocannabinoids, and synthetic cannabinoids. Endocannabinoids are, as the name suggests, it is produced inside our body. How it is produced? It is produced by exercise, meditation, and swimming, pranayam, and yoga, asana, all these things that produces your endocannabinoids. There are two types of endocannabinoids. One is the andamides and one is 2-AG. And phytocannabinoids, they are produced from the plants. And synthetic cannabinoids, they are produced from the laboratory. So cannabinoid type of plants, the cannabis, what are the type of plants? We know these are the three types, mainly three types, and other is your hybrid. The sativa, one is indica and rudalis. Sativa is mostly seen in the Central Asia and Central America. Indica, as the name suggests, it is mostly seen in Bharat, Afghanistan, Pakistan, and Tibet. And rudalis is in Russia, Central and Eastern Europe. And other is a hybrid. And in our medicinal use, this wild indica and wild sativa is not usually used. This is a hybrid is used. Hybrid was sativa and indica hybrid. Sometimes sativa dominant, sometimes indica dominates, according to the where exact it is cultivated, and which company takes which type of hybrid plant for the medicinal purpose. Why this cannabis sativa is more popular? Only because the sativa is allowed in India. Other thing is higher CBD and THC ratio. And CBD is for anti-inflammatory, anxiolytic, and anti-epileptic. And THC is controlled at a lower and moderate THC causes controlled psychoactive effect and makes it safer for the chronic conditions like pain, anxiety, epilepsy, and inflammations. You can use in the daytime and conditions like fatigue and depression also. But this cannabis sativa, again, that is mostly it is used hybrid. For that is the reason whether it is a THC rich or CBD rich, that we will discuss afterwards. The medicinal significance are there's more than 100 compounds are identified in the cannabis plant. Major classes are cannabinoids, terpenes, and flavonoids. Cannabinoids are, we understood that THC, CBD, CBG, CBN, and CBC. Mostly this THC and CBD, these two cannabinoids we use. The THC are primarily psychoactive cannabinoids in cannabis, can be used in the pain, nausea, appetite stimulation. Whereas CBD is non-psychoactive and it is potentially helps in the anti-inflammatory action, pain relief, epilepsy, anxiety, and inflammation. THC rich can be used for the chronic neuropathic pain, chemotherapy, induced nausea and vomitings, and appetite stimulation, muscle spasticity, glaucoma. The formulations we get in the THC rich or sometimes CBD rich and balanced THC and CBD. THC rich is used for the pain, nausea, and appetite spasticity. The pros of the THC is strong symptoms relief and mostly caution to be taken. It is psychoactive and tolerance will be produced. CBD rich is used for the anxiety and epilepsy inflammations, non-intoxicating, safer, and less potent for the pain. CBD rich wala. If it is balanced, THC and CBD balanced, used for the chronic and chronic pain and fibromyalgia, it is synergistic effect. Mild psychoactivity is possible. So when pain and inflammation occurs in the body, immediately that gives a signal to enzymes to produce endocannabinoids. Endocannabinoids, once it is produced, that goes to the CB1, CB2 receptors, and according to the where it is acting, and our pain, inflammation, immunity, that modulation occurs. Cannabis sativa is a plant with medicinal, recreational, and industrial values. Now, how the industrial values? Because the seeds are used for in the industries. They're in the textiles, paper, biodegradable plastics, and building materials also. It is used. In the cannabis sativa, the seeds, leaves, stem, and root, all these are used. What are the challenges ahead is doses and purity is till now is not standardized, and more clinical trials are required, and public education, because using cannabis is taboo, so that public education is to be improved, and balancing access and control. So immense medical potential when used for potential is responsibly. If at all use, then we can explore lot of medicinal value of this, and it was used previously, and we should know how to titrate the THC and CBD. If at all we know this, what condition we are giving CBD when we will give THC, that hack if at all we will get, that knack once we will get, we can use it very nicely. And the future lies in the balanced integration of this policy, science, awareness, and this must be aligned. Thank you.
Thank you. Thank you, Dr. Darsh.
Can I ask a question?
Yeah.
You said that Rishis knew about the central path, the peripheral path, and cannabinoid path, and they hacked it. So what do you mean by hacking?
That means this is if the CB1 receptors are getting stimulated, then your pain management can occur. If at all CB2, which are present in the periphery, then the immunity will increase. The other parts, if at all this CB1 is activated, then you will increase the psychoactive things will occur. All these things can be titrated according to the THC and the CBD. And as the time goes, with the way we in anesthesia we titrate with the molecules, that way this also we can be titrated as we do practice. All these things are theory now, because we are not doing practice much.
No. That time I'm talking about 1500 BC. When they knew about it, did they know the different uses of it for different purpose?
Yeah, they used to use now.
Obviously, they did not know about
About
CBA,
cannabis,
CB1, CB2.
all those things were not, but they knew in other way. They might be using in other way.
So, for different indications, is there a different dosage or different plant?
And different now what I understood from all these things from exploration, I understood that now the plants what the hybrid plants they raise, that is sativa dominant or indica dominant, that way.
No.
So accordingly, the CBD dominant or THC dominant, you will get the leaves. With that, if at all you are making the medicine, accordingly you will get the medicine which is CBD dominant or THC dominant.
Like what you said that repeated, but did they know the difference between them?
That time?
That time?
Must
You
be-
don't know.
Oh, we don't know. We don't know. We don't have.
They usually are used
he
as a
would be
mood
able to-
elevators.
He would be able to
That's
tell
what
us.
we-
Dr. Chhatre would be able to
Yeah.
give a more insight on this.
Sir, because I am from Ayurvedic background,
I know.
basically what we consider rishis, actually at that time it was just like a degree to scientist. When we call Acharya, it was professor. So in Charak Samhita, even before that also Agnivesh Samhita was there, and there also Vijaya is already mentioned, Vijaya, Ahifen and all those. Even now we can get Ahifena Sau. So that is also allowed to use in the Ayurvedic proprietary, Ayurvedic generic medicines. So at that time, though we say that it is used only for the pain or inflammation, actually it was based on the dosage. So if we increase the dose, at that time in Sushruta Samhita it is mentioned as the anesthetic. So even for the skull surgery also, the Sushruta has used it as the anesthetic, and they have mentioned the dose in what we can say that Gunja, Ratti and all that, not Tola, because one mash or one Ratti is equivalent to around 125 milligram. So they have started the dose from half Ratti or one Ratti as a painkiller, and they have increased it up to 1 or 2 mash, that is 1 to 2 grams, as an anesthetic. So at that time they were not knowing about CB1 and CB2.
Yeah, so it was dose related. Basically, it
They
was
were
dose-
talking in terms of Vata, Pitta and Kapha.
Yeah.
If Vata is aggravated, pain is generated. And this Ahifen or Vijaya, they are basically used as the most potent Vata Nashak medicines. That is a painkiller. And when we say Vata, that is basically Gati, that is the speed. So speed not only what we consider as the gas, but whatever the nervous system, all the messages are continuously in microseconds. They are passing from finger to the brain. So that is also comes under the Vata. And they have discussed all the pharmacology in terms of Vata, how does it act and all that.
Dr. Chhetri, now we are talking about that the ratio, that there will be a psychoactive effect or it will give the pain relief. Which one will be better? Now here there are hundreds of your cannabinoids total. Out of that, 2 are the mainstream. One is THC, another one is CBD. Now if you take into consideration, THC basically gives the psychoactive effect, also pain relief, because it acts on both CB1 and CB2 receptor. Whereas your CBD acts only on CB2 receptor. So it gives the pain relief and as well as inflammations will be controlled. Now when we manufacture this product, particularly in our product, what we have done, we have reduced the concentration of THC and increased the concentration of CBD. So it is 2:4, but 20% and 40%. So that's why it will not give any psychoactive effect, but it will relieve pain and inflammations effectively. So that way it has been done.
That NDPS Act and other things. So one question is, because we are in a corporate setup, to acquire this particular products and keep it in a pharmacy, when I'll go from here, I'll ask my pharmacy people to make it available in their IP and OP pharma. So are there anything for them to know to, that fulfillment criteria or any?
So I can I can throw some light. So we can.
And in what quantity? Is there a, like we should have this much stock only,
Yeah.
we can exceed that? So
No, sir, there is
you
no,
can throw
there is
light
no specific regulation for keeping this stock. It's because it does not come under NRX category.
Okay.
It is not a narcotic. So this can be easily be kept in a sufficient quantity and can be dispensed in the store. Though it comes under Schedule E1 category, but does not require any special permission to keep it or any records to be kept.
Okay.
Yeah.
Because when we use fentanyl patch, we have to.
Yes, yes, that's right. Because that comes under NRX category.
Right. Also, can it be dispensed on OPD basis?
Yes, it can be dispensed.
Sure.
Yes, can be dispensed.
In private clinics, can as well?
Yeah, private clinics also can dispense. Yes.
And India,
We cannot control chronic pain or fibromyalgia only with one drug. We have to give some medicine also, I think for 2 weeks or 3 weeks. Other drugs also like analgesic with this cannabis.
yes,
Cannabis will not help you to control pain and all, inflammation.
We have to
no,
do
see,
multimodal.
so
approach. It is
multimodal
not
treatment
only-
is
only-
there. Suppose in case of your non-steroidal anti-inflammatory drugs, we are using selective, non-selective COX-2 inhibitor. In both the cases, we are facing problem. If we go for non-selective COX-2 inhibitor, GI irritation, then nephrotoxicity, coagulation of blood, these are the things are there. Even selective COX-2 inhibitor, if we go for that, we have seen that there is a cardiac arrhythmia, QT interval prolongation. That's why a lot of selective COX-2 inhibitor, it has been withdrawn from the market. Still, this etoricoxib and your palmicoxib, that is also under scanner, because it has been found that there is a cardiac arrhythmia and there is a QT interval prolongation. Yes, opioids also, if you go for that, habit formation, respiratory depression, constipation, there is a lot of problems are arising. So in this case, cannabis, if you take into consideration even your THC and CBD, your ratio, if you can keep it in a proper manner, then it will give better analgesic and anti-inflammatory effect. There is no psychoactive effect, no GI irritation, no constipation, no habit formations. These are the problem will not come across. And there is no chance of your QT interval prolongations. So that way the safety profile is good enough. Even also it will give better efficacy. And yes, of course, in certain cases, only cannabis you have given. Along with that, non-steroidal anti-inflammatory drugs, if you would like to use, you can use. It does not mean that I'm using cannabis, I cannot use any other analgesic or anti-inflammatory. If you think so, that it can be used.
The cannabis plus any analgesic that gives the synergistic effect.
Now, there is no such clinical trial till date that suppose I am giving your selective COX-2 inhibitor or non-selective COX-2 inhibitor and cannabis it has been given and it will enhance your analgesic effect, it has not been found. In case of your ibuprofen, diclofenac, when we add paracetamol, yes, it enhances your analgesic action, but there is no such clinical trials available right at the moment. We can claim that cannabis and along with non-steroidal anti-inflammatory drugs, if we give, then it will increase the analgesic effect or anti-inflammatory effect.
Also, one important thing is that have any other effects with other substances, like sometimes alcohol and cannabis, can they give additive effects? Because many a times my patients, when we are giving gabapentin or something like that, they do ask, can we take this thing in combination? So, is there any,
Because the safety profile.
because there is a cough syrup also available in your
Drug interaction, any drug interaction or
Yeah.
alcohol.
Drug interaction you're talking about.
Yeah.
See, generally when this cannabis is being taken, during that period, the alcohol should not be taken.
Yeah. So we should instruct that to our
Yes.
patients, right?
Because the drowsiness
Yeah,
will
because
be
cough
more.
syrup will add
More.
something on
Because
that.
your THC is there, it
Yeah.
acts on your CB1
Psychoactive.
receptor and simultaneously you are also taking alcohol.
I want to ask
Lastly-
I want to ask you a question. Is cannabis is an Ayurvedic product? As a allopathy doctor, legally, can we prescribe this?
Yes, of course. See, I would like to tell you certain things. We use silymarin. Silymarin, it is derived from your Silybum marianum. It is basically a herbs. But silymarin is being used by allopathic doctor. Reserpine, it is being used by allopathic doctor. Your
Even metformin.
anti-malarial drug, quinine.
Metformin is also from
Quinine,
the
also
herbal.
cinchona.
Yeah.
So everything, your opioid derivative morphine, it is coming from opium, that is also from herbal.
My question is, in black and white, it is written that cannabis is a Ayurvedic product. When you see the cannabis, cannabis vial,
It comes-
is written the Ayurvedic.
It comes under Ayurvedic
Ayush,
proprietary
Ayush
medicine.
category.
Ayush category.
Yeah, it comes under Ayush category.
Ayush.
That, in that particular medicine, if a allopathy doctor will prescribe,
So-
it is legal or not?
Legal, it's legal. See, I would like to tell you, legal, see, I would like to, see, here I would like to tell you, you have seen that leaf 52. What is that? This is a absolutely herbal medicine, Ayurvedic medicine. A lot of doctors. I would like to tell you, your nephrologist, urologist, they use cystone from Himalaya, okay, for dissolve your kidney stones. So it is absolutely an Ayurvedic product. It is not an allopathic product, but lot of nephrologists, urologists, they use
This
it.
question comes because it is a
Yeah.
cannabis.
Yes, sir.
And everybody count on that. It is a cannabis. Cannabis is, can you?
Speak on the mic, if you don't mind. Yeah. Okay, so can this be used for chronic neuropathic pain,
Yeah,
Yes.
and how long?
depends. I don't know much about
See,
it.
there is
Clinical trials.
there are
everything.
certain clinical trials are there. It has been given for 8 weeks initially, and there is an improvement of neuropathic pain. And now after that, it has to be continued. That decision has to be taken by the medical practitioner based on the symptoms.
Sir, I think I just,
Metabolic, diabetic neuropathy.
sir, I just want to add something on that. I think it's not the duration, it's the addiction. So the question really is whether you get addicted to taking this cannabis regularly. So that's the thing. So cannabis per se does not cause addiction. So when cannabis does not cause addiction, only the dose incrementation is the problem. So if the dose incrementation is controlled, then the duration of therapy shouldn't matter. So for chronic conditions like diabetic neuropathy and neuropathic pain, it can be used for prolonged periods of time. And this is very important because full spectrum cannabis is being used in epilepsy in childhood disorders for a very long time. And children take it for years together. So they are not getting addicted to it because there is controlled dosage being given to them.
Thank you, doctor. This insight. Now, I would like to call the second presenter, Dr. Nana Morkane.
I think
Your topics is the role of cannabis
interestingly,
sativa
Dr. Das has covered whole of my topic.
Okay.
So let's move on to the next topic and discuss more about legalization, clinical trials more, and what is how we can bring into our practice. Because
Okay.
frankly speaking, we have not used it regularly. Regularly, never used it. So let's.
Okay.
Because whole presentation is covered already.
Covered. Okay. Now.
Hack.
Okay. So now I would like to call Dr. Neerad. See, this is a very good topics, that is legalization of cannabis. So legalization of cannabis.
Okay, I'm here. I'm talking from here.
Yes,
okay.
you
But
can.
again, sorry. This topic, as you see, I'm not again shifting the topic from me to somebody else, but I'm an orthopedic surgeon, not a lawyer. So legalization, whatever I'm going to be talking is what you all have presented to me, from which I can understand, I can go through it fast. Is that it's still not okay? Let me just. Can we go ahead?
Yeah,
Is there a-
Yes, yes.
Yeah.
Or should I come there? Okay, let me come there. Fine.
Yeah. Or you can even click from there. Okay, thanks.
So I think everybody's interested in getting it in the country. We all know the advantages of it. The legalities of it is beyond my scope. But so I'm just these things have again there a lot of things have been overlapped. There's medical, recreational, industrial uses of cannabis, and we talked about THC and CBD, the advantages, disadvantages. I mean the ratios of it and how it helps us. This is just a slide showing the trends of how cannabis was introduced and where it stands now. We know that it was used initially in India and thanks to the British, they came and made it, even Americans have actually, there's some data of, I think in 1985 they stopped the growth of cannabis in a lot of countries because of, they were scared of the exports and the what do you call it, like opium, they were scared of the drugs being imported and exported in different places. So from the UN's WHO point of view, I don't know, this is what you all have given me, that they've suggested recommending removing of cannabis from the Schedule 4 drugs. And now the UN has started approving it or recognizing its medical potential. So it's fully legal in Canada, Uruguay, Thailand, and several United States. I mean, in several of the states in the US. And for medical use in India, in restricted use, but I don't have much knowledge about this. And again, in Europe, there's a lot of acceptance of cannabis. It's illegal in a lot of Asian countries. So the regulatory law in India is the NDPS Act that we know of. And so this data that you'll have given me is that the 10th of August, that cannabis has been approved by the Government of India to be included in the Ayush group. And only the seeds and leaves are approved, not the flower and the resin, which are the more potent product from the cannabis plant. And it has been they have allowed it to be grown. I think in Uttarakhand and Madhya Pradesh also there's growth of this plant that is allowed. Besides this slide which says that they're allowing it they're growing it in Jammu. So typically the northern states were where they grew the cannabis plant. Not that I know of.
Sir, actually, no, because it requires little hilly area.
Hilly areas.
So even not.
I think it's more of a geographical thing. It's a geographical thing.
So
rather
therefore,
than
it's in Himachal, Uttarakhand, and northeastern states, it's allowed. I mean, they have been grown. They have because suitable. Climate is more suitable for this plant. No. Yeah. Though each and every state has its own laws.
The states have their own laws. That's what I was told.
The
that
states have their own laws.
There's no government ruling on where you can.
Yeah. Because the excise department, they purchase the entire crop and then they auction it to the manufacturer or the users, and they should have the necessary licenses.
So if it is legalized, obviously there'll be medical benefits, there'll be give jobs, there'll be economic growth, there'll be, again, this criminal justice reformation, obviously there'll be there are different issues that we have to take care of, and obviously it needs regulation and safety. And against the health risks, the potential for addictions and for the illegal use of it, the access to children and underage people. Again, regulatory challenges and the stigma that, where you're using cannabis, it's still not accepted as a routine drug. I mean, even with, I guess, all of us in day-to-day practice, people are not comfortable using Ultraset because they think it's an opioid drug. So we face that. So with cannabis, I guess we'll have a separate thing. So I think in Canada it's done really well. It's made a lot of impact. Their growth it's improved the economy to a large extent, since it's legalized there. And so these would be the challenges, I think. But I think this will require a higher level meeting, government issues, and I don't know whether our 20 people, odd people here are going to make major changes in that. So more countries are looking at decriminalizing it and legalizing it. Obviously, a lot of more effort has to be put into making the right, as doctor said about the ratio of 20 to 40, making it probably that would be the optimal ratio. And that's where we stand at the moment. So it's going to be a complex issue. I don't think we at the moment know much about it, but let's see. Let's hope that you all. I mean, I think it's the need for the hour. I think we do need this product in the market, definitely. Thank you. Thank you so much.
Thank you, doctor.
Thank you, sir.
Unless you know the legality and
Yeah.
the whole thing, you would not come with this product.
Yeah, definitely, sir. Yeah. So we have done our homework as far as the bringing the products is concerned. Yeah, but why we took up this topic was that because this was a question that everyone was asking, how legal it is and whether this can be prescribed by the modern medicine doctors, and whether this is legally allowed in the country to be grown. So that's the reason why we purposely brought up this topic.
Middle East is very strict about this.
Yes, sir.
So,
yeah.
Like even if they are carrying along with them,
yes, sir,
they have a problems. So I think we should be careful about prescribing to the patients coming from Middle East. And we should
Yes, sir.
specifically instruct them.
So, Middle Eastern countries and all those countries do not allow this.
Do not have at all, at all.
So it's actually a fact, because initially the first time I saw CBD oil was available freely in Thailand. So I assumed at that point of time that Southeast Asian countries would have it, but Singapore has completely banned the use of cannabis. So we have to be very careful when prescribing to international patients, and because carrying it into the country will actually put them in a suit.
Particularly if you see the European country, it is legal. Medicinal.
USA it is allowed.
US, even not only that, in case of Germany, it is being used as a medicinal purpose, but not recreational purpose. Okay.
Yeah, it is. In Germany, it is strictly for the medicinal
Purpose only.
Yeah, but
Here it is used as a bhang for everything, yeah.
But if we are just talking about the Maharashtra, in Maharashtra, as sir has asked whether it is allowed to prescribe Ayurvedic medicine. So in Maharashtra, there is a GR with us that any pathy can prescribe other pathies medicines. So
share that GR with us. It's going to be helpful.
Yeah, we have got it. Yeah, definitely.
Because there are some smart patients.
Exactly.
Question.
That's right.
So what about the duration? I mean, how long you can use and...
See, generally, yes, it can be given for a longer period of time. Generally, the clinical trial which we have, that is for 8 weeks.
Okay.
8 weeks.
Anyways, you're discussing clinical.
8 weeks therapy, the clinical data is available.
Some mics.
And 8 weeks in the dose of what? How much dose? He said that it is irrespective of the dose, but I'm sure if there is a habit forming something.
No, it's a topical application. It has to be applied 2 to 3 times daily.
I'm talking about
Sir, right now
Oral, sir,
we haven't come with the oral form as of now. We have an oral form of Instactive 4, which is from a non-cannabis source, which we are recommending 1 tablet twice a day for 90 days. 90 days. Because it is not from cannabis source. Indication is any chronic pain like your arthritic pain, fibromyalgia, rheumatic pain. So in such conditions.
So if the patient's pain reduces, you still continue?
No, sir, that's up to the discretion of the physician and doctor.
That's what I'm saying.
Yeah,
You
yeah.
said 90 days.
So that's a duration, sir. Yeah.
I'd like to tell you that beta karyophyllene, it can be derived from your cannabis. It can be derived from
Clove.
Actually, we have derived from clove.
And also, sir, just want to put the point here that Instactive 4 does not come under Ayush because it is not a cannabis. So it comes under nutraceutical. So which is a FSSA, under FSSA.
Now I would like to invite Dr. Aditya Khemka to give the role of different formats of cannabis.
One doubt, the PPT mentioned it can cause issues with driving, the previous PPT. So does it really interfere, causes sedation? How is it?
See, particularly in case of your drowsiness, I have told you that it depends on that when it will be manufactured, the ratio of CBD and THC. This is the main concern. If your THC concentration is higher side and CBD is less, then your drowsiness and hangover will be there. And that will be little bit, even operating machines as well as driving will be little bit difficult. Drowsiness will be there.
Thank you.
So sir, I would like to request you just give a light on the role of different formats of cannabis in chronic pain management.
Yes, hi, I'm Aditya Khemka. I'm an orthopedic surgeon. So I think let's talk practically. Till now we've been discussing where it acts and whether it's legal or not, but I guess everybody is here to know how we use it, so what the different formats are. So I'm not going to go, we are living in a social media era. Every patient who walks into my clinic talks about not getting painkillers, whether it's an educated patient or non-educated patient. So a product comes by which says it's an Ayurvedic product because at the end of the day it's derived from a plant and it does not cause very many side effects except for the fact that it causes some amount of psychoactive effects if the THC component is more. So this is a very good product to use in any clinical practice, be it orthopedic surgeon or pain specialty. So the whole idea is how to use it in different formats. We've already discussed THC and CBD and all other cannabinoids that are present. We've discussed the CB1, CB2. Obviously what intrigues me as an orthopedic surgeon is that it has effect on muscles and bones somehow. So that's the most important. But here is basically the most important slide of this presentation. So CBD is available for inhalation. So this is something which has not come into the market yet, but it has become available. And so everybody knows about vape. Vape is essentially oil which is transformed into smoke. So the CBD oil is definitely available. It can be transformed into a vape cigarette, and you can actually, yeah, so this topic is very interesting, not only for prescription purposes, but for personal use. But that's a different conversation.
Quite a few of I guess many of our colleagues must have had it in a college days. College days, fellowship तो बहुत बाद में आता है हीरो.
Sir, private practice days, नहीं.
MBBS level पे काफी लोगों ने भांग के अलावा भी बहुत चीज ली होगी.
Everybody here present, they will give you a...
So we'll replace the alcohol trolley with the...
Yeah, sir, sure, sir, we'll do it.
So inhalation is very important. So what is important to know about inhalation is it acts within 5 to 10 minutes. But it's a very short duration of action for 2 hours. So this is a very important take home. Oral. So yes, oral is definitely available in India. Multiple companies are doing it. It's available as full spectrum, as I said, for children, ADHD and epilepsy disorders. It starts acting in 1.5 hours. So what's the key thing is it's comes in a capsule form. So it can pass through the gastric, this is very important for us to understand, and it lasts for about 8 hours. Again, sublingual is obviously faster, but sublingual is not yet come in unless you take the topical CBD oil and put it below your tongue, which can be done and a lot of patients have done. So the most important, or what intrigues me as an orthopedic surgeon, especially doing arthroplasty, is topical use. So of late I've become very used to using Buvilor patches and fentanyl patches. And they've given me a very good alternative to Dynapar and Perfalgan, which doesn't do anything to my post-operative patients at times. So topical usage of these products, the whole idea is that when I apply a transdermal patch, ideally it should last for 8 to 12 hours, but one patch apparently 125 milligrams of cannabinoids with a low amount of THC and high amount of CBD lasts for about 24 hours. So this can be actually a game changer in arthroplasty or sports medicine practice when we're applying one patch a day from day 2 onwards without a psychoactive effect, mobilizing the patient and reducing the pain. So reducing the dependence on analgesics.
You apply at the site of the surgery or proximal to that?
So this is the philosophy which came from the buprenorphine patch. The one anesthetist actually mentioned to me that you apply it below the left side clavicle, where the absorption is the maximum. So it wouldn't act locally, it would get absorbed and give it to the entire system. So I would normally stick to applying it below the left side of the clavicle.
Is there any rationale? Because my anesthetist puts it below the tourniquet, on the same side.
Sir, that's a little dangerous, sir, because infection, but I don't know, but so what I understand is the blood flow in this area would allow it to get absorbed fastest and quickest.
Not sure.
And
इधर भी लगाते हैं, इधर भी लगाते हैं, सब जगह पे लगाते हैं वो लोग रे.
see
सब जगह पे लगाते हैं.
and topical में sir I encounter one major problem. Most of our creams and gels have menthol. And as we are going ahead and as this COVID era is going, COVID shield, I'm getting a large number of patients which are allergic to menthol application in most of these gels. So CBD oil application will really help in these cases. Obviously there is limited evidence compared to a chronic pain and acute pain. So it's more for chronic pain rather than acute pain, because the duration of action only starts acting 1.5 hours later. So that's very important. Obviously inhalation and sublingual routes are preferred, but it's not going to happen. Practically it's not possible, because if we start prescribing inhalation routes for everybody, then it will be abused more than anything else. There is much stronger evidence in chronic pain. So this is covering Ramsar's question that neuropathic pain and fibromyalgia are very good. Oral and transdermal formats are the primary formats which we would like to use this product in. So the other question was how to combine with analgesics, right? I want to reduce my dependence on NSAIDs and opioids because I want more patient compliance. And nowadays, even the most illiterate patient becomes more patient compliant if you say you're not giving painkillers. So just a little repeat on inhalation. So rapid onset, short duration of action. Vaping is obviously preferred over smoking it. The oral formats are more for chronic conditions, long duration, delayed onset. Sublingual is for breakthrough and mild persistent pain. This is like nifedipine, like we give for heart attacks. Then the creams, the oils are the most important topical, so they have been available for a year and a half. The commercial oils which are available, so I'll shed a little light on legalized oil. So initially, these masseuses started getting CBD oil in it. And they started getting about 2 to 3% of CBD oil in it with a small component of THC. But 3% really didn't cut the chase. So then they increased it to, so in fact these guys, InnoCare has increased it to 6% cannabinoids in the oil, which has actually increased the amount of efficacy in topical applications. It gives you localized pain relief. Transdermal patches are what my real interest is, because that will prevent any abuse. For from my point of view, as a private practitioner in today's era, I want to be legally very safe. I don't know if I prescribe an oil to a patient might drink it. It's happened to me. So transdermal patches prevents that from happening. Transdermal patches allows us to give the pain relief. So this is something which is very interesting once it comes out. So obviously steady state, easy compliance, a slow onset, but the cost is going to be high. So that is where we need to work on reducing the cost. But from what I see is 2 patches were available for 325 rupees, which is cheaper than paracetamol, because Perfalgan is available for 900 rupees as an MRP. So this is much cheaper. Of this, 24 hours. The bioavailability says 8 hours, but it can last for 24. So again, like I said, dosing and titration, I was telling sir, start low, go slow. Obviously, Murkane sir as a pain physician will prescribe it more. I'll probably be prescribing the lower doses at all times. CBD dependent, because less psychoactive, so that again comes to driving. More we don't do these activities after gabapentin. I tell my patients to have it at night and not drive, or not drink rather. So that is the same advice which one would follow. Monitoring side effects is very important. So transdermal patches, for that matter, can have local arrhythmic side effects where they can cause an allergy. So that is something which we'll have to watch out for. Again, the analgesic potency is much less than opioids, but the dependence is much less than opioids. So addiction comes into point. So then that's why it's the same as NSAIDs, which gives us the idea of using them. Education, according to patient-centric considerations, is very important. You have to explain, and geriatric population is not a problem, they'll listen to you, but the kind of patients that you're getting now at 25, 30, 35, the Gen Z which you talk about, I prescribed Gufican oil, which was available as 3% CBD. This lady actually abused it by taking 2 drops every night, not having a drink, rather than she actually took it in the shisha also. It gave me an idea actually, but we'll but so education is very important. Monitoring and follow-up is essential. Obviously now InnoCare has launched multiple products. Hopefully they'll come through in the next 1 month, and happy that all of us can prescribe it. Right? So you say yes to cannabis, but is it like saying yes to drugs? It's for every individual to decide really. Thank you so much.
Thank you. Thank you, doctor.
One question is that when will the patches come, number 2? Like in sometimes we put 25 microgram and then sometimes we put 1 more patch to make it 50 microgram.
Patch. First question is the patches are coming in maybe maximum in 1 month's time, with less than 1 month's time in the market. And second thing, as you said, multiple patches gives it'll give the addition of the dose. Yeah, I mean, theoretically, yes. Yeah, I think, right, if I'm, sir is saying if you put 2 patches, obviously you'll get double the dose. So,
yes.
I think it should be because it's transdermal patch.
Generally,
so
if you ask me, genuinely, the duration of action, it is 8 to 12 hours. Okay, not more than that. Okay, generally 2 patches daily will be the effective, but most of the cases 1 patch will be used throughout the 24 hours.
The most important thing for us is that first 24-48 hours of pain, because when the patient starts mobilizing, usually
So 2 patches will be better. Of course.
Yes. So coincidentally, we have 1 pack of 2 patches in that.
2 patches will be the ideal.
Yes. Yeah. Yeah. So cost wise, sir, we have brought it in a very.
And
Exactly. So
Yes.
350 rupees, one patch, one actually costs 175, which works out to be so. See, if you're practicing in a corporate, I'm practicing in corporate, but we're looking at a small hospital care. This reduces the consumable bill significantly. Just imagine, even if you were to use 2 patches a day, day 2 and day 3, the patient goes home.
Or we can even space this out across 6 hours or 8 hours.
Absolutely, and it minimizing my side effects of Buvilor and fentanyl.
Because most of the patients become cranky in the night. When next day I go for rounds, क्या surgery किया रात को नींद नहीं आया.
I think it can be patient specific also. Some patients, even fentanyl patch we use, it is actually, it should last for 72 hours. But there are patients, it has lasted for 5 days also. 4 5 days. So, patient, it is patient specific. So we can.
Patient specific also we can use.
Sometimes one patch will be sufficient for 24 hours also.
Is it, can it be difficult to
Absolutely no problem in this sense.
Actually, there is a question that in Maharashtra, this cannabis is legal or not. Okay, if there is a valid license is there, then it can be used. So in case of your medical shops, if they have a drug license and everything, they can keep it and they can sell it. That has been approved.
Because when tomorrow I go to my hospital,
Yes.
and make it available, they will start questioning.
Yes.
See, I am working in rural. Lot of transplant, lot of messages, lot of. So pain is a big thing. When I use it, there will be other doctors who will criticize it, who will go for it.
No, it has.
Will come on my side.
They have made it legal.
Sir,
You don't go, let them go.
Sir, no, sir, we'll help her out in any kind of they want any support in documentation. We'll definitely be there. Sure, definitely, sir. Yeah. Global, sir, we already have our products are available. But this product making it available will make sure it happens. Yeah. Yes, sir. Because as I said, sir, they come under narcotics. So.
So now our next topics is medical cannabis impact on social. Dr. Rishabh.
No, Dr. Mayank.
Mayank.
Hi, I'm here.
Okay.
So the topic given to me is to talk about the recent clinical trials on the use of medical cannabis. As we have been discussing about the cannabis, a lot of literature and lot of studies were evolving how to use cannabis, and like Dr. Khemka was mentioning that the Buvilor patches, in fact, in our arthroplasty practice, we have seen that it has been a game changer. It takes away the pain and a significant reduction in terms of the NSAIDs used. So maybe one of the things which we can have with us, which we can use for pain management. Now, how much it is, evidence proof? Let me discuss. So this we have already discussed the various constituents of cannabis sativa, the mechanism of action. We've already gone through, Dr. Chitranjan has already gone through all of this. So the first, the references which have been provided by InnovCare through these slides is published, was a retrospective cross-sectional study of patients where 244 patients were given this medical cannabis and with a chronic pain, and between 2013 to 2015, and what they have demonstrated is that medical cannabis use was associated with a significant decrease in opioid use, a decreased number and side effects of medications, and definitely an improved quality of life. And they have suggested that patients with chronic pain are essentially substituting medical cannabis for opioids and as well as other medications for chronic pain treatment. In another study published in 2020, where it was a randomized double-blind placebo-controlled trial in 29 patients with peripheral neuropathy, where they have applied topical CBD oil and the control group was a placebo, emu oil without CBD oil for 4 weeks. They have seen a significant reduction in intense pain, sharp pain, and various sensations were observed in CBD group as compared to the placebo group. and it was found to be safe. And even the neuropathic pain scale, they have shown a significant improvement. This was the chart when compared to the placebo group, the CBD group has behaved well in terms of the pain management. In another article which was published in 2020, where they have done another randomized controlled trial of topical cannabinoid for the treatment of thumb basal joint arthritis, they have seen that when this topical application in and around the thumb basal joint arthritic area, they 1 week for twice daily application, they have seen that the CBD, topical CBD treatment demonstrated significant improvement in thumb basal joint arthritis related pain and disability without any adverse effects. In another study in 2024, where they have seen the effect of full spectrum cannabis leaf extract on pain, inflammation and quality of sleep, it was a case series where the oil based tincture was given sublingually at night for 1 month, and the initial dose of 5 to 10 drops was gradually reduced. They have shown that the 70 to 99% reduction in pain, spasticity and inflammation after the application of topical oil-based tincture. And one of the recent publication in 2025 where a clinical trial was done to assess the efficacy of hemp seed oil on knee osteoarthritis. 90 patients were randomly allocated to 3 groups. One is hemp seed oil group, another is the diclofenac gel and the placebo. They have seen that all the scores, the VAS score, the WOMAC score, were significantly improved in hemp seed oil group as compared to placebo. However, it was as effective as diclofenac gel. So someone was mentioning that whether it can replace or maybe act as an adjuvant to what we are already using as an NSAIDs. So these are the various, these were the limited evidence which has been shared with me in regard to the clinical trials. I think so more and more clinical trials are awaited, and more clinical trials in terms of efficacy, the duration for which which can be given without any adverse side effects. Thank you.
Thank you, Doctor. See, we'd like to tell you that we have done the clinical trial, particularly in case of oil and gel. And in case of your gel, we have compared with the Volitra gel. And in case of your oil, we have compared with the Dr. Ortho oil. And we have taken certain parameters, VAS score, WOMAC score we have taken. Even also we have taken into consideration that the inflammatory marker, yes sir, then your CRP, their reduction was good enough. Even your improvement of pain relief was good enough as compared to your Volitra and Dr. Ortho. We'll give you this clinical trial shortly. This clinical trial, it has been approved by EC committee, ethics committee. Second one is that it has been registered in CTRI, and DCGI has given the approval to conduct this clinical trial. Even they have allowed us to compare with the drug, vis-a-vis your cannabis.
What about the oral trials on the oral use of cannabinoids?
See, oral of actually cannabis is has not been launched by anybody, and because the safety profile and clinical data, it is not enough. But in case of topical, there is a lot of data. You have seen that whatever the clinical data, all are topical.
Yeah.
So that's why there is some restriction. Yes, of course. Gummies, you will find this gummies. It has come. One or two companies online, they are trying to push this thing, but the clinical data, enough clinical data is not.
So that's a work in progress.
One question I had, in regard to the use, whether whenever we are giving this should be given at night because it may cause sedation, or it can be given during daytime.
But orally, if you take, yes, of course, your bedtime it has to be taken. Even also gummies, if they take at the bedtime, they have to take morning, and that is also depends on your THC and CBD. That ratio is most important. your THC is good enough or more than your CBD, then obviously in the morning it will be very difficult.
Because topical also has some absorption.
Topical is absorption, but whatever absorption you will find orally, that you will not find to that extent. Okay.
So the work is in progress, sir. In fact, gummies we have developed, but then we have not yet come out because we want some more clinical data before we launch in the pure cannabis in the oral form. So as a answer to your like CB2 receptor acting, we have come out with Instactive 4, which is a beta carotene, which is also in the family of endocannabinoids. So that can be used in right now as an oral form. It will not have any psychoactive side effects because it will only work on CB2 receptors.
It can be given even in the morning, in the afternoon.
It can be given in morning and evening time, anytime it can be given, sir.
Because it has been derived from your clove.
Clove, yeah. It's not from the
cannabis.
Yeah.
Okay.
Yeah. So, but this is the first time that we are. We thought that at least in the topical form, in patches form, and in oil and gel, we can come out with the pure cannabis. But yes, once we get more clinical data on the oral form, we'll definitely come out in future, sir.
Okay. Dr. Rishabh, I will request you to give a presentation on medical cannabis impact on social aspect.
Hi. So basically, we're just going to be giving a brief discussion about the social aspects of the medicine. So basically, there are both positive and negative aspects in each medicine, in each drug, and again, it depends on what you're using it for, the context, and for what individual factor. Was it like for joint pain in our case, or for ADHD, or like Dr. Khemka said, some people get it for epilepsy and such. So now there are a lot of people who will say that they have experienced positive results, they feel better, the anxiety is reduced. Those are the positives, you can say, and some face isolation because when people say that they're taking some kind of cannabis product, there is still a little negative impact, where people think something is like, they'll say charsi hai, like how we say. So that's one of the social anxiety disorders that people face. So now again, as it says, that the impact varies on things like the environment. So maybe somewhere in Bombay the impact is lesser. Somewhere in a smaller village, if you're taking it, the impact is greater. So just in short, the positives that you will notice is basically what we are saying is, I think, already been covered, is improved medical access, because now we've been able to also isolate the receptor that we are targeting and making it only a CB2 receptor. There's reduced opioid use. The economic benefits have already been spoken. A lot of countries, states have opened up the use of cannabis and products. So I know for states in like Colorado in the US, where they opened it and they did so much business that the residents who were paying tax were getting tax refund, because the government was making more money in cannabis alone and its products than the tax that they were collecting from its residents. And of course, the negative things that we already said was something like recreational use, accidents while driving, mental health issues, and the social stigma. Now, the whole point of at least this product, I think, is basically to target just the CB2 receptors, which then avoids all of this recreational use, the accidents, the mental health issues. The social stigma, unless people are educated about it, will remain. In India and abroad also, decriminalization has already started as covered prior, and legalization again frees the law enforcement resources from here. This also was already covered in terms of the global market. 100 billion by 2030 is what they are predicting. A lot of countries like Thailand, who have recently opened its doors to this, they did so well that they made so much money that the government tried to retract the legality, faced backlash, and then noticed an economic dip. So they reopened things again. And again, it boosts agriculture, pharma, wellness in the same sectors. So I think, as we've already discussed in short, in a nutshell, what happens is that we are looking at targeted therapy. So we don't want a psychoactive component. Delivery systems like Dr. Khemka has already said about transdermal patches, oral tablets, sublingual, and hopefully looking at more targeted CBD-based treatments.
Thank you, doctor. And our last presentation, actually it's a post-marketing surveillance on beta carotene, that is regarding the beta-cannabinoid.
Good evening all. So Insectifort, it's a oral non-cannabinoid tablet form. It gives excellent result provided it should be used in a precise format. So in the patients with chronic pain and inflammatory conditions, it gives almost 70 to 80% relief in 7 to 8 weeks period of time. In acute condition, it is not helpful much, but overall, it gives excellent result to the patients with the chronic inflammatory conditions, fibromyalgia conditions, and all. Thank you.
Achha.
Thank you, all of you, for giving real insight regarding the cannabis.
So, भूख नहीं लगा?
For giving this support, and we want support from you regarding further evaluations of your cannabis, because in your private practice, when you will use it, you will be able to understand is there any side effects, and efficacy is whatever we are claiming or whatever clinical trial it has been carried out, from there we have come to know. But your clinical experience is the most important, and that we would like to get the feedback. That's why we have made this ad board, and this support we require from all of you. Yes, if you want that, we can provide you the protocol, simple protocol.
Case record form we can give you. Yeah.
Yes, sir. For that we'll be able to give you. We have also piece of your So
you can use your hip and knee score. Accordingly, you can use the same score here only. I have used in 95 patients for Insectifort. So it gives a moderate to severe, done to the mild to no pain at the 4 to 6 weeks period of time. Given once a day, or in severe case initially twice a day, then switch over to the once a day. It's non-addictive and it gives in very good result in chronic inflammatory condition and fibromyalgia condition.
Yes.
So we'll give you that particular.
It will be
around 15 days we switch over to the only Insectifort without any NSAIDs, without paracetamol also.
It will be just one
thing
as a suggestion, and you can give your global impression at the end of.
See, if patients, you have to check the psychological conditions and other medical condition. Accordingly, you have to choose, because it's a non-cannabinoid. It has no any addictive effect, and it is safely given 3 months or more than 3 months also. Depends on the patient's condition, but minimum 1 month and maximum 90 days.
Suggestion which I would want to know is when you are prescribing like a cannabinoid, be it a patch or a gel, what is the fit of that product? Like, do I have to give it with a particular tablet? Like, the options which we have available right now is, let's say, opioids, non-opioids like NSAIDs and something like paracetamol. So when I'm prescribing, where does this molecule fit into that spectrum of the drugs which we already have right now? So is it an isolated molecule which we have to give, or is there a protocol where we can give it with another molecule?
It's not clear, because it's a standalone, because it's a so it's a Ayurvedic proprietary medicine.
So let's say I'm giving a ketorolac patch to patients. I'm giving a butyl or opioid patch as well. So how do I decide when I have to take a cannabinoid patch and not go for an opioid patch, for example?
That means you are talking about the this is head-on trial. You are talking about the head-on trial. That means you would like to see that the comparative study. There will be a reference product and there will be a test product.
Pre-existing molecules which are there?
Yes, See, that sort of clinical trial, we have to do that. That's why this ad board has been made it, that we'll do this clinical trial, we'll make a protocol, we'll give it to you, and you will check it from your end. This is one, that is called post-surveillance study. And in future, we'll also do the clinical trial, where we'll take the ethics committee approval, CTRA registration. Also, we'll take the approval from DCGI, and we'll do the comparative study with the conventional drugs.
I can give this answer. Actually, what exactly he is asking. Whether he is
Talk on the mic.
Yeah, when he is giving NSAIDs and he is giving a bular patch, when he wants to add this cannabinoid, how he will add?
How do I decide whether I want the cannabinoid vis-a-vis bular patch?
See, basically, the way the bular patch is acting in different way, or NSAIDs are acting in different way. Okay, that is the way this cannabis also act in other way, because they are having CB1, CB2 receptors, and through that this is acting. Then you have to titrate when you will remove the NSAIDs. 4-5 days हो गया, NSAID निकाल दो. अभी tramadol चल रहा है, tramadol थोड़ा दिन चला सकते हैं. उसके साथ you are putting this. At the first few days you can, after post-operative, you can put your bular patch, means buprenorphine patch. Then with that, if at all this CBD you are giving, it is okay. If it THC you are giving, then you will have more issues. So accordingly, you have to titrate.
See, that's why we are talking about multimodal approach. Because see, when you are giving non-steroidal anti-inflammatory drug, it acts on COX-2. When you are giving your capsaicin sort of things, that is anti-substance P drug. When you are giving opioids, that it acts on opioid receptor. When you are giving cannabis, it acts on your CV1, CV2 receptor. So there is a multimodal applications will be there, approach will be there.
Probably the product market fit which is there, like where exactly is the indication of that molecule. Over time, as we start using with multiple molecules, we might have a better protocol and understand that. Let's say we are giving a tramadol tablet, and if the pain is not subsiding with the tramadol tablet, just add a cannabinoid patch compared to probably a ketorolac patch which was used earlier.
Yes, so when if that way you will be able to overcome the side effects of your opioid derivatives, and secondly, you are adding these things, your pain relief and inflammations will be taken care of.
I think, sir, you have given a very good food for thought on this, that we should do a comparative trial with the this ketorolac and or diclofenac or the ones which you are using it currently.
At the same time, the whole idea is that this should replace all those NSAIDs and other patches. So that is the whole idea. So why not start it with cannabinoid? Why try with others? Maybe it will help you at all, no, totally.
Thank you. So I will request sir to give the closing remark and vote of thanks.
Right, okay. So first of all, thank you very much, sir. I really thank from the bottom of my heart, from the, so in fact we have been so fortunate enough that you all have come today and given your expertise, given your time, valuable time, and given your insights and thoughts on your clinical experiences of your currently used formulations, currently used therapeutic options, and also suggested us a lot of new ideas that what we can do in the future. So this will really help us come out with more innovative products in future. Sir, I would like to now first also take only few minutes, so that I want to felicitate and give mementos to our main speakers. So first because sir, I think Niraj sir would want to leave a little earlier, so I am requesting Suman sir to please come and give a memento and felicitate Dr. Niraj Venksarkar sir. Okay, sir, please come. Please come, sir. Blank, but lighter now sufficient. Thanks. Thank you very much, sir. I want Suman, please stay on. Sir, request Sir Dr. Ram Prabhu, sir. So, who's been the chairperson for this meeting and for advisory board? So please, I'd like to give a memento to Dr. Ram Prabhu, sir, for gracing the occasion. Yes, sir. I request Kailash to please come and felicitate Dr. Rajesh Gandhi, sir. Sir, please, sir, been a chief guest and to accept our invitation to. So without you, no program is complete, sir. So right. Harish, my colleague, he will felicitate Dr. Aditya Khemka. Sir, Khemka, sir, I request your presence, sir. Yes. Yes, please. Thank you very much, sir, for your such an insightful presentation and also giving us, a new direction. And thanks, sir. We all value your suggestions. Thank you very much. I request my colleague, Mr. Kapil, to please come and felicitate and present a memento to Dr. Chittaranjan Das. Yes, Akhilesh, okay. Since Kapil, Akhilesh is coming, so please come and please, sir, Dr. Chittaranjan Das, thank you very much, sir, for really setting the tone and giving us an overview of the role of cannabis in the chronic pain management. Thank you very much, sir. Thanks. Right. My colleague Mr. Vinod will now facilitate Dr. Nana Morkane, sir. Sir, you have always been a backbone in the and always helped us in in chronic pain management therapies. So thank you so much. Thanks, Dr. Morkane, sir, who has been a guiding force behind such introductions. Thank you. I request Kailash once again. Where's my Kailash, please come. Yeah. Sir, I request Dr. Mayank Vijayvaragya. So please, sir, please come and been very thanks that you have given us the clinical outcomes of the role of medical cannabis in the chronic pain management therapy. So please accept a memento from us. Thank you so much, sir, for your presence, and thank you so much for your insights. Thanks so much. I request Mukesh, my colleague, who's always been very energetic. Okay. So I request Dr. Hitesh Sutaria, sir, to please come and please accept a memento from us. Please come. Okay. I request Manish, please come. I request sir, Dr. Mitesh Walvi, sir. Sorry, sir, we missed you in the beginning. Sir, please come, sir. So I request Manish to please present and felicitate Dr. Mitesh Walvi, sir. Please come, sir. Thank you very much, sir, for being always been a supporting us and has been really giving us these ideas and very sure. Thanks a lot, sir. Thanks. Yeah, and finally, Vinod, please stand by. I would like to request Vinod to please give a memento to our medical advisor, Dr. Bijoy Dev. So, Bijoy Dev, sir, you have been instrumental in and been coordinating and overall making this a success, bringing these cannabis range of products. Okay. And also I'll request Dr. Rishabh Hegde, so please come on dais. Please come, sir. Yeah, yes. Please come. And I will request Mukesh to please felicitate Dr. Rishabh. Thank you very much, sir. Thanks a lot. Right.
Dipinji, sorry to interrupt you, but Momento ke sath sath you should be giving a vape also, no?
Yes, sir. In fact, sir, they told me that the vapes are not allowed here, so we will have to go out and use the vapes. Yes, yes, sir. Vapes are also now is going to be the next thing that we'll come out with. Thank you very much, sir. Thanks a lot. Okay, so I really thanks my entire field colleagues, who really worked tirelessly along with you all and troubled you a lot in the last 1 week or 2 weeks. And also, I also have been instrumental in putting them onto this job. So I really thanks each one of you to grace the occasion, come in the evening, spend a valuable time. And I'm sure we all must have now when we leave from here, sure we might have added some few more things, some more options, in our clinical practice which we can use. And I will request you all to please try our this new range of products: Instaactive oil, Instaactive patch, Instaactive Imul gel, and already available Instaactive 4 tablets are already available. Okay, so I thanks a lot. But before you all leave, please do join us for a dinner. Okay, and now the session is open for informal discussion. Thank you very much. Yes, sir. So, would like to add something.
So, on behalf of InvoCare, I really thank everyone who have come here. Actually, I was a little suspicious, and I really didn't know that so many people would come.
Yes, sir.
It's been raining. It's a long weekend.
Yeah.
People would like to have their own free time, but I think they have come in. That shows the confidence in the company and probably this newer molecule.
Sir, that's I think it's been your love and affection.
And I think this product is definitely going to do well. First of all, everybody is going to try it, and then they will continue to use it. I'm sure about it.
Yes, sir. Yes, sir. Thank you so much, sir. Thanks a lot for so encouraging words, sir. So your presence and your words itself is so encouraging, sir. Thanks, sir.
Your team has been exceptional in coordinating and organizing.
Very nice of you, sir. Very nice of you, sir. Thank you. Thanks a lot, sir. Thanks a lot. Thanks to everyone, sir. Thanks a lot. So please join us for a dinner and drink, sir. Thanks, sir. Thank you so much. Thank you.